Let me show you some gentle type of adjusting that I would possibly do for someone that has whiplash. I'm right on a joint that's tight, so just nice and gentle. I may hold that for a few seconds. So I'm going to feel his back, and I can feel some tension in here, and it's putting that impulse in there a couple of times a second. See, that's moving much better. Today I'm going to be talking about whiplash and the chiropractic adjustment. I have a patient here, Dana, and I'm going to be going ahead and demonstrating the adjustment. If you go ahead on your back for me, your head this way, your feet down that way. So just a couple of things before I actually do the adjustment. I've been in practice 31 years. The last 4 years I've been specializing in whiplash or auto injuries. Interesting thing is, you know, these patients, when they get in a whiplash, often, you know, they have a lot of pain initially. There's a lot of inflammation or swelling that comes into the area. And also there's a lot of tightness or muscle guarding or spasms, so they don't have a lot of movement and it's painful. So I like to go super gentle with the adjustments. You know, of course, depending upon what the exam tells me, but so I'm going to show you how I would start out with the really gentle adjusting. I should say though, and this is important, that it's not just the adjustments. I do a lot of different adjunctive therapies to help with the whole process. So, you know, with the adjustments in the background, we're doing some physical therapy procedures, things like electric muscle stimulation, which is going to help to relax the muscles and also help to retrain muscles to help hold it in the right place and to work with pain gating to help reduce pain. We'll also do another therapy like intersegmental traction, which will help start pumping some fluids to promote some healing to the discs. Often we're going to use a cold laser as well. That promotes healing from the inside out, so really powerful and effective. We also will probably do something like some in-office supervised rehab. That's where we have you doing exercises in the office and we're watching and guiding you and specifically formulating it for you in your case, but that's going to help to stretch things and start improving your flexibility, which is something we want, and also strengthen the muscles, which is something that we want. And then another significant component to all this is we do an hour-long deep tissue massage that really helps break up scar tissue and adhesions to help with the healing. So all of that is in conjunction with the adjustments. So that being said, now let me show you the adjustments. So I'm going to feel Dana's neck. I'm right on a joint that's tight and I'm pulling a little bit in a specific direction as I'm stretching, just very gentle, but to help get things starting to move a little bit better. I certainly don't want to try and do too much at once, so just nice and gentle. I may hold that for a few seconds. So I'm going to gently push with this hand going forwards and a little bit going backwards just to really stretch that joint. The next thing I would do is I'm going to feel the individual joints in their neck to see how they're moving or not moving. This instrument adjusting machine is amazing. It makes some noise, and then as I push, it just puts some gentle movement into the joint, but it's pushing quicker than those muscles can tighten up, so it lets me gently get on a specific joint like this and get it moving better. Most people often think whiplash is just the neck, but that's not necessarily true. You can have a whiplash in the lower back as well. So I'm going to feel his back. And I can feel some tension in here.
Feels a lot better.
So that's, the types of adjustments I do on whiplash type of injuries. Gentle but effective, and again, we combine that with the other therapies to get a great result. So Dr. Michael Pasternack, chiropractor, Winchester Spine and Injuries. Follow us on social media, and we're here to help you any way we can, answer any of your questions. Have a great day.